Breasts are the milk-producing glands in the female body which are made up of connective and fatty tissues. Sometimes, due to some reason, breast tissues start growing abnormally, which leads to the formation of a tumor or tissue mass in the breast, which is called breast cancer. Due to breast cancer, the female breast gets painful swelling and stiffness which, if not treated, can spread to the lymph nodes and other body parts. Hence, breast cancer needs to be treated, for which breast cancer surgery is performed. There are two types of breast cancer surgery, which include lumpectomy and mastectomy. If the tumor growth is in a specific region of the breast, then lumpectomy is performed to remove it. Whereas, if the tumor growth spreads to the entire breast, or in some cases, spreads to the lymph nodes along with the breast, then mastectomy is performed to remove it. However, in the case of mastectomy, the complete breast tissue is removed. Hence, if the patient wants to do breast and nipple reconstruction, then a separate surgery is performed for it. Procedure: before surgery, the patient's medical history is taken and some tests are done so that the tumor growth can be identified. When the tumor is identified, surgery is recommended to the patient. During surgery, the patient is given anesthesia and made unconscious. And a small cut is made near the nipple in the upper region of the affected breast, which removes the tumor tissue in the breast through lumpectomy. Sometimes, wire-guided surgery is performed in the case of lumpectomy so that the tumor growth can be identified and removed without damaging the normal tissues in the breast. If the tumor growth spreads to the lymph nodes along with the breast, then mastectomy is performed to remove it. For this, the lymph nodes in the armpit region along with the breast tissue are also removed. If the patient wants to do breast reconstruction, then often after tumor removal, breast reconstruction is done through silicone shells or bale fits. And at the end of the surgery, the wound in the breast skin is closed with the help of sutures. After surgery, the patient is transferred to the recovery room and discharged after a few hours of hospital stay. If only tumor removal surgery is done, then the patient is discharged on the same day of surgery. However, if breast reconstruction is also done along with tumor removal, then the patient is discharged after a couple of days of hospital stay. So I hope you must have learned something new from this video.